Good morning, this is Mike Furman with Iredell Free News. We're here today at the Iredell Statesville Schools Administrative Offices on Ray Street with Dr. Jeff James, Iredell Statesville Schools Superintendent, and three other gentlemen who are not on camera yet. Richard Armstrong, who's the District Athletic Director and Director of Operations, Jay Keener, who's the Lake Norman High School Athletic Director, and Josh Gregory, who's the Athletic Director at North Iredell Middle School. Gentlemen, we'll get to all of you in a second, but Dr. James, I want to focus today on high school wrestling. We've got some feedback from our interview last week, and there are questions, concerns from parents. Wanted to give you a chance to address those, and then we'll kind of just go around the table.
Well, Mike, thank you. And of course, last Friday we did have a venue where you and I talked about several things: prom, graduation, and wrestling. And we never said in that interview that we weren't going to have wrestling. It's going to be very difficult. So hopefully today I'll clear some of that up, and I think we've come up with a resolution. But I will say this to our stakeholders: thank you for doing what I've asked you to do. If there's a decision we make that you want to weigh in on, by all means, you've done that. You emailed me this weekend, and I can tell you between myself, Assistant Superintendent Armstrong, and the coaches, we've probably put in several hundred hours calling other states and doing a lot of due diligence to see if at all possible we could make wrestling happen. So your feedback helped us dig a little deeper. But that being said, Mike, Governor Cooper and the legislators passed a bill recently called Bill 220. It was a joint resolution between the legislators and the governor. This bill allowed us to reopen the school, but this bill had two caveats that school systems had to agree to in order to return under Plan A. The first one was that we worked with the ABC Science Collaborative. So in our thing Friday, I didn't really go into detail. That collaborative is a group of Duke medical doctors and immunologists. They have been publishing research from data they're collecting from what's called the 11. We are the largest school system in the 11. We've been with them for 6 months, and actually, Mike, it's the data they've collected from Iredell Statesville schools that was used with the national CDC and the North Carolina Department of Health and Human Services to allow us to come back to school. So our data has helped us get back in school. So our board and myself and our leadership has pushed from day one to get kids back in school. However, understanding, again, to those parents that are still fearful that their kid can do the remote learning option. So every principal will be working with parents, and we have some staff that are at risk. So what we're doing right now is scrambling in 612 with those staff members that are at risk. They may be teaching kids from 2 or 3 high schools, but to fill up their virtual class. So it takes a lot to make this work, and as I said before, there's a lot of logistics here. It's just not a simple yes or no answer. So ISS, of course, has been with the collaborative for some time, and the biggest thing that we've been concerned about is, there's been very few deaths in young people. I fully agree with that. It's not the deaths that are a concern. The quarantine rules is what will determine if we stay open or not. And I just told you, I just received a document last night and a document again this morning saying the 6-foot rule is not going to be dropped. Well, that is the biggest thing we've been advocating to get dropped, because within 24 hours, if I've been within 15 minutes of being within somebody that is infected, then I become quarantined. So think about our sports teams. That can quickly happen. So our board, the leadership, again, have worked tirelessly. We've been talking to lobbyists, our legislators, government officials, to share the data we've had to get us back open. Our data has shown for many months that having students attend face-to-face really hasn't propagated COVID. Our in-school spread has been non-existent. We've had like one case over 6 months, 1 or 2 cases of student-to-student spread, and we really can't say that really happened. But again, so we've had very good controls in place. It's worked. Our data, along with other districts, was what we shared with elected officials in Raleigh and assisted with getting this bill passed. So we're proud of that. We know that the school's the safest place to be right now. ISS has worked hard to ensure those wanting to return could, and those who are still fearful could still get an education through virtual. With that said, our work with our friends at Duke, the ABC Science Collaborative, drives home the fact that the safety protocols must be in place in order to mitigate the spread. In short, when we don't wear a mask properly, COVID spreads more rapidly, especially if we're in that 6-foot bubble. The CDC has just recently dropped that to 3. The collaborative has said 4 months ago that 3 foot is really the threshold. But again, this morning, they're holding us to the 6-foot quarantine rule. Each week we post our COVID data on our website, how many students are quarantined, the amount of secondary spread, etc. So we've been very transparent on what's going on. We have to be. And so as we moved on a couple of weeks ago, our secondary spread numbers went out the roof. Well, the ABC Collaborative is monitoring our data. So they call Dr. Nutting or myself and say, guys, your data's starting to spike. You might want to do an audit of these schools. And so we do a mask audit, or we go into the lunchroom and see if kids are too close, or if our faculty's too close. So it's not on a gotcha, but it's just precautionary so we don't have mass fatigue. So while our secondary rate remains low, we saw a significant increase 2 weeks ago directly attributable to sports. So I can tell you that the largest number we ever had, and very significant number, took out an entire team for several games. Well, here's what happens. With that spread, it just didn't affect the team. Mike, if you were on that team and you were asymptomatic and went to class, you now have taken classmates out, and lo and behold, we had staff members out because of the spread. So there is some concern when we play sports in close contact. So again, the collaborative told us 6 months ago the worst thing you could ever do is wrestle, because it's body-to-body contact. And if I'm sick with COVID, the chances of spreading it to you when we're touching and our sweat's transferring and saliva is through wrestling. So we've always had concerns, and I've told the board, and we've discussed it as leadership here. Well, let's wait and see what happens with the state, because wrestling is going to be one of those things very hard to do. So Friday, I said, I'm concerned. Didn't say we were canceling it. But again, with all the feedback, we've done a lot more due diligence to try to get data that supports moving forward. So from the onset, the part of this group, there was concerns about this exposure. So again, I've asked our stakeholders to weigh in. You did. So today I'm sitting here telling you that Richard and I, Mr. Armstrong, we called Q Tucker on Monday. I fully well understand that's high school, but if we're going to wrestle in high school, it's not equitable not to wrestle in middle school. That is a local decision, but it's not fair if we're not going to do both. So we have to make a decision what's best for all kids. So we talked to Q Tucker, respect her, had a long conversation with her. You know, we're concerned because the ABC Collaborative, who we're part of and required to partner with to come back to school, is telling us, if you're asking us, the answer is no. And so Q Tucker said, well, guys, we've asked sports medicine people, we've talked to numerous other states, and we cannot find data that supports an increase in transmission through wrestling. So, and I said, well, that helps us make a better decision. So that was a piece of data we didn't have. And so I appreciate her input to it. I actually called 13 other superintendents, and out of that, there's at least 5 that are moving forward with wrestling. So again, Mike, data that makes me feel a little bit more comfortable making a decision. Because what the parents need to understand, all parents, I have to maintain safety for every child. Our board does. So if wrestling comes in and shuts the whole school down, and it happens to be your child that didn't wrestle, you're going to be calling me going, why'd you let wrestling occur? Now my child's out 10 to 14 days. So it's a bigger picture than just a simple wrestle or not wrestle. And we do want your input. And you gave it, so you made us again go back to the drawing board, talk to our coaches. We polled. I actually asked Richard to privately reach out to every single coach that had wrestling and get their individual opinion, not do it as a group. That way, if you really didn't feel comfortable, you had the ability to tell Mr. Armstrong, I really don't feel comfortable coaching. So what he done was put the data together and say, well, overall, our coaches want to move forward. So when he told me that Monday afternoon, we had a conversation, and I said, well, let's make this happen. So I contacted you and said, well, let's have a conversation to our general public and, calm some fears. So as of today, Iredell Statesville Schools plans to move forward with wrestling. And these guys will talk, but I'm going to ask you as parents, this is the most at-risk behavior I think we have done so far. So we really need your help. If your child's just not themselves or not feeling well, you can get a simple test. And if there's monetary issues there, if you'll contact my office, we'll somehow get you a test for free. But work with us. Please don't put your child on the court and they're not feeling well, because again, the symptoms in children are asymptomatic. You may just think it's a cold, or he's just not feeling well today. And if it happens to be COVID, it has the potential to take out multiple students and even shut a school down if it's that bad. So just work with us and we can work through this. So Mike, the other thing was graduation. We're having face-to-face. We're going to try to do it outside. And I understand in the past you can invite 6-8 people of your family. It might not turn out that way. If we have it indoors, it greatly hampers how many people we can have in. We do have guidelines that we have to abide by. We can choose not to, but then we assume legal liability. And we're just not going to do that. I'm not putting the board at risk or this district. So we've got parameters we have to operate in. We can't just throw the box in the trash. So I'm just asking you to work with us, and we will do what's best for kids. And again, while some of the emails I got weren't too nice, that's fine. I take constructive criticism. And again, we took your input, we dug deeper, and today we're telling you that we're moving toward wrestling. So with that, I'll let you talk to some of the other guys.
Sure.
Thank you, Mike.
Thank you. Dr. Armstrong, wrestling season for middle schools is scheduled to begin on March 29th and high schools on April the 12th.
Correct.
Tell me a little bit about what you're going to do with your coaches to ensure that the students are as safe as possible.
Okay, so thank you, Mike. I did send an email individually to every wrestling coach in our school system, each middle school and each high school. And basically I asked them 2 questions. How many do you feel that you can safely bring student athletes back to wrestle? And I'm just needing a yes or no question. And then the other question is, if we bring these wrestlers back, how do you feel about wrestlers wearing masks or not wearing masks? And so I received answers on those. I'm happy to report that all 5 high schools felt comfortable with bringing their wrestlers back together and having a wrestling season from our 5 traditional high schools. Our middle schools, we have 8 8 middle schools that currently wrestle, but I have a feeling about 3 of these 8 will not be able to field a team. And it's just mainly due to the numbers, low numbers, and not being able to safely host a team. And so that's another issue. But the mask issue has not been determined. Most of our coaches felt like during actual competition, wearing a mask for a wrestler would not be advantageous for the wrestler. And so I tend to agree with that. But any other time they're not wrestling or they're on the bench or not competing, they will have a mask.
And what about in practice?
In practices, they will have a mask when they're not going really hard at wrestling. And I don't want to create other issues with breathing, but wrestling's a tough sport. I've coached it. It is. I also play football, but wrestling, I'll say it, and some football people may not be happy, but wrestling's far tougher on an athlete than football, because I've been experienced with both. But our coaches said basically whatever the rules are, whatever the state says we do about masks, that's what we'll abide by. But if you're asking us, and Q Tucker asked me just to poll our coaches on how they felt about masks, and that's what I did. But the majority of our coaches felt like masks in a competitive situation would not be advantageous for wrestlers too.
So the state is not going to require masks. It's going to be
do not know yet. We do not know yet. I'm hoping they have an announcement this week.
Okay.
But I'm not sure.
All right. Mr. Keever, Mr. Gregory, maybe you just weigh in for 1 second about what things are going to look like at your schools in terms of how you might do things differently for wrestling practice, if you're going to have the same number of matches that you would normally have, the same number of competitors, those sort of things.
Well, first off, I want to, kind of go back to what Dr. James was saying about with in the winter sports and with basketball, the numbers going up. There was a time when I didn't think athletics would continue, period, after basketball. We had 2 JV teams and a varsity team out in quarantine all at one time at one point. And as an athletic director, I was very nervous about that. But then as we got to the outdoor sports, things have started to taper off. But now we're talking about wrestling, which is bringing things back inside, and the obvious close contact and everything like that. the biggest thing that's helped us at Lake Norman and for me and my coaches has just been communicating expectations. Making it clear to my coaches, when this happens, you do this, or when this happens, you need to let this person know. So I think we've done a pretty good job at our school of following protocols and following chain of command when it comes to COVID and who needs to be contacted. And I think that's helped us stave off COVID a bit, but it's still there. And we're still having students test positive. It's not going away. But the biggest thing, again, like I said, is making your expectations clear to your coaches and having your coaches making their expectations clear to their athletes and the parents. Because, that's the most important thing, health and safety of our student athletes, and making it a success. That's, like you said, one person can take out an entire team for the entire year. We're limited on matches as it is. And if you lose 2 weeks or possibly 4 weeks, if another case pops up, that could be very detrimental to someone's season. So, again, just making clear expectations and setting them in front of, coaches, players, and parents.
I totally agree with Jay on that, and that's one thing that we try to do at North Middle as well. And we've had constant communication with our administration. We trust their opinions and trust their leadership. So that's been a big help through all this, that constant communication. Just trying to, I know a lot of kids on the north end are excited to get back in wrestling, as well across the whole county. But we do, like Mr. James said, do have to take those steps. And if your child is not feeling well, we have to take that precaution and take extra steps, especially with wrestling, because it is a close contact sport. So I think if we do all that, I think we can be successful throughout the county for the year, and we'll just go from there.
Gentlemen, thank you for joining us. Dr. James, we'll let you have the last word.
Well, Mike, just want to thank you and thank our stakeholders and appreciate your emailing us. And I think your voice was weighed in at the table and it made us relook at things and probably come out with a little bit different perspective. So again, thank you, and please continue to do that as we move forward.
All right, thank you.